Hello, dear aquarist. Welcome again to one of my videos on fish diseases. And you selected this one because you want to learn something more about diseases of betta fish, Siamese fighting fish. And the bettas are very popular in the hobby. They have been bred and cultivated mostly in Asia. And breeding fish, like I explained in many of my videos, is also a risk of cultivating certain fish diseases. I will explain in this coming PowerPoint what I find in my experience the most common problems that we are currently dealing with when we have betta fish, Siamese betta fish. So I will share you my PowerPoint, which I made for the Italian Betta Association. And of course, it's in English and it might interest you. The details I'll provide for you today on the most common diseases of betta fish. The most common diseases which I found in my practice as a fish doctor are bacterial infections. First of all, fish tuberculosis or mycobacterium, very common. Internal bacterial infection, that is mostly due to bad food or bad feeding practices. And the Columnaris bacterial infection. And then we have parasitic infections like velvet disease or Oodinium, scientific name is Piscinoodinium, and white spot disease or Ichthyophthirius. Here I show you a group of betta, and some of them are seriously suffering from fish tuberculosis, Mycobacterium. Here you see this one in the middle, which is slowly wasting away, not eating. Others show little problems, but maybe more in the coming months or weeks. Here is another one, which had fish Mycobacterium, fish tuberculosis, caused by the bacteria Mycobacterium. See how much damage, how much bad fins and tails. Fish is still active, but that's gonna die in a few days. Here is another one. That looks okay, but still in that aquarium a few dead ones were reported, so we examined and we found, like in this red one here in the middle, that they were suffering from mycobacterium or fish tuberculosis. So the signs are not very typical, the very different signs or symptoms of this disease, fish tuberculosis. We could see Popeye, like cloudy eyes on this left betta here. Also here on this betta, we can see some ulcers in the fish. We can see some holes in the fins and some damage on the tail. Many different symptoms caused by fish tuberculosis. Or here on the left, the skinny fish wasting away, or a fish with serious, badly damaged fins hanging at the surface. So many different symptoms. But the thing we found typically when you do an examination with the microscope, and you examine the organs, we found tubercles internally in the organs, here in the liver and on the right in the kidney. All tubercles taking away healthy tissue, creating a bad organ. The fish becomes weak and becomes also proneable to other infectious parasites or bacteria, secondary. But the fish is usually wasting away and will die in days or months, sometimes years, can take a long time. So what can you do as a treatment? First of all, is doing a correct diagnosis, is using a microscope, yes, or sending the fish to a laboratory or sending some tissues to the laboratory, because I could not define mycobacterium by using a microscope or in my laboratory. I always need a good laboratory who does a good diagnosis of the type of bacteria we are dealing with. It can be mycobacterium. Sometimes we also could find nocardia bacteria. But anyway, let's talk about, in this case, about our mycobacterium. The treatment has little success when the bacteria are encapsulated in the organs, like I showed you on the previous slide. The bacteria are inside the capsule and cannot be reached by the antibiotics or the medications. Maybe the beginning stage it might be more successful. And when you administer the medication through the food, adding it to the food, but that only when the fish are still eating. Some people tried and some said they had success with following antibiotics: erythromycin, rifampicin, oxytetracycline, azithromycin, doxycycline, florfenicol, and sulfamethoxazole. Ask your veterinarian, your fish doctor, your pet shop, or read my books. I explain how to administer and what to do as treatment. But for fish tuberculosis, I always think about, why did it happen? How come this infection occurred on my fish? So I can learn lessons from it. Because prevention is better than cure. The most common source of this infection is the breeder. It's the mother fish, the betta female, that passes it on, the mycobacterium, through the gonads to the eggs of the fish directly. And it can also come inside the fish through the fish food that is contaminated with mycobacterium. Like mosquito larvae are known to be prone affected with mycobacterium. And the heavily infected fish that are suffering should be put gently asleep. You can use a medication or a tranquilizer like a Narcomor Plus, for example, from Aquarium Münster. And for the other fish, well, in the aquarium, which are still doing okay, try to stimulate the immune system so they become more actively defensive against the invasion of the bacteria, or to get too much tuberculosis to prevent, so the organs are healthier. And that you can do with pro and prebiotics in the fish food, like I can recommend, or Dr. Baslier, Biofish Food Forte. So the fish can survive and live for many years. Be aware of tank granuloma, which is a zoonosis. That means that you as mankind can become infected, particularly your hands. The wounds on your hands can become infected with mycobacterium. I will explain that later on the next slides. So when you have a wound that is not good healing, keeps on becoming red, an ulcer, go to your doctor and tell him you are a fish keeper and that you listen to the presentation of me, the fish doctor, talking about fish tuberculosis or mycobacterium. You need a specific treatment to be cured. Disinfection of an aquarium. People ask me, well, should I disinfect the aquarium when I have tuberculosis? That has only sense when the origin is avoided, when you still have a female or fish with tuberculosis, or when you're still feeding fish with mycobacterium. Why should you disinfect? You'd still create a problem. See my special video in my YouTube channel on fish tuberculosis, which is available in 4 languages. I will give the link below so you can go in more detail on fish tuberculosis if you want to learn more. The hand. Well, the risk for infection from mycobacterium, you can see it here on the finger of a young man who had a mosquito bite and keep on scratching because it was itching, and the bacteria came inside. Look, there's another wound developing here, and that can go further. It can go further, other parts of the hand completely red. That's the things you be aware of. Look, the wound is getting further, getting other parts This man had a mycobacterium infection by a wound on his head. He was scratching because he had a mosquito bite. It was itchy, and he was dealing with this kind of discus, with this kind of wound. Very similar wound infection, both on the head and both caused by mycobacterium. This disease is called the zoonosis, tank granuloma. This man working in a public aquarium at a tropical center had very serious damage and a risk of losing his arm if not properly treated on time or not detected on time. You can lose your arm or your hand. Be aware. But just a bad hygienic, that's all you have to do. Be careful. Take care of your hands and your wounds. Avoid going into the aquarium. And here we show you another part of the diseases that involves our fish is when the fish have wounds and some fin rot. Common problem with bacterial infections. This was not due to mycobacterium, but could be. But still, this was another type of bacteria. This is another betta fish suffering from a bacterial infection. Look at the bad fins and the tail. That fin and tail rot. Badly damaged, bacterial infection. Sometimes there is little damage on the tails and the fins, but internally the fish was badly infected. You can see different symptoms, wounds, red lesions, many different things that can show to be a bacterial infection. But still, you see fin rot, you see wounds, reddish wounds, you know there's bacteria involved. I showed you so many different videos already and pictures. Then you know that the bacteria can play a role. And of course, the microscope. The fish doctor can help by doing examination. You can see here on the left the gill rot. That's why the fish dies, because the gills are so badly damaged. And here the infection is in the kidney. See the blocked parts loaded with bacteria. How to treat a bacterial infection? Well, in general, for any bacterial infection, the water change is the first action to do. Do as much water change as you can and administer an antibacterial medication. Ask your pet shop or your veterinarian what you should do because it depends what they have available. But the water change is the most important action. Why? You get fresh water and you dilute the water from the bacteria. You expel the bacteria. You siphon out the bacteria. You get rid of the bloated bacteria in the water bowl or in the aquarium. Take care of that and check your filter. Maybe the filter was polluted. Check that. The sooner you start treatment, the better the results. A laboratory can determine the kind of bacteria, and you can check then for the best antibiotic. Of course, the laboratory, particularly when you're a breeder and you deal with a lot of betta fish and you have serious ongoing problems with wounds, not only for betta, also for other fish, a good determination of the bacteria and what antibiotics should work, that should be an important way of finding out what antibiotic will do the best job. We call that an antibiogram, and a laboratory can do that for you. It costs some money, but if you deal with a lot of bettas or you love your bettas, it's very valuable, it's worthwhile spending some money. At the same time, a fish food can help the fish, a functional fish food that helps the fish to regain immunity, strength, like our Dr. Basler Biofish Food Moringa, can be a help for you. First of all, try to look for the cause. Important that you know why this happened. In most cases, it's polluted food, food loaded with bacteria. Sometimes in frozen and live food, you can find too much bacteria. Dirty water conditions, bad filtration, overcrowding, not enough water changes, too much food left on the bottom, and stress. Stress can be lack of hiding places, too many fish, too many disturbance, too high temperature or too low, etc. Many things I'll talk about in my other videos about stress. So this is an example of an antibiogram on a culture of bacteria, which is here set out on the plate, and all the gray mass is the bacteria growing well. And where it's not growing well, like on this part and this part, that means the antibiotic has an action that the bacteria cannot grow. That means that antibiotic, these two are working properly depending on the how much bacteria are not colonized here. And here you can see these ones are hardly having any effect, so not working at all. Check with a laboratory, check with a veterinarian. Well, Columnaris disease, a nasty disease, completely white finch and white body, you can see here. And then look, his friend is already eating on the damaged finch and also taking on or picking up the bacteria. So he will be the next one who will be infected with the bacteria because he's eating on the fish which has an infection. Look at the dead fish in the bag. But it goes very fast. White finch, white necrosis, typical for Columnaris, particularly when the water is above 25, 26 degrees. Here you see some samples, or you can see examples of the typical symptoms for Columnaris disease is the white mouth and the white saddleback here, the white necrotic dorsal part, dorsal fin. Here also, look at this whitish part on this bed on the right here. They call that the saddleback syndrome. White mouth, typical for Columnaris. And Columnaris you can detect in the microscope when you're a little bit lucky. You can see these colonies here on the scale. And that looks like a ball of tubifex and moving like tubifex. That's how Columnaris bacteria look like in a colony. When you're lucky when you take a microscope. But Columnaris is common. It happens quite often. First of all, do a big water change. Again, very important. Eliminate the bacteria, put fresh water, lower the temperature. Try to keep it below 23 degrees Celsius because the bacteria, Columnaris, do not like water below 24 degrees. They don't like to grow. They will still not be killed, be aware. At the same time, you can add sea salt, 3 to 5 grams per liter, maybe adding it slowly. The bacteria does not like sea salt, so it doesn't kill, but it controls the growth and the infection to be under control. What kills the bacteria is an antibiotic, like neomycin sulfate or enrofloxacin, like Bitril. See my books. Ask your veterinarian how to use. And at the same time, a functional fish food, again, helps the fish to regain strength to fight off the infection. In this case, we recommend the use of Dr. Baslier Biofish Food Fuco. Avoid overcrowding, avoid stress, and check what you could do better next time, what to prevent. Important for you. Parasitic infections. Oodinium, something that we see quite often by the bettas. Difficult to see with our naked eye. You see some turbidity on that betta. Do I see it? Maybe. Very difficult to see turbidity. You see some damaged fins again. It's secondary bacterial infections here. Also this one on the bottom here, on the anal fin. But the parasites, Oodinium, velvet disease, were the main cause. Here is another betta with the cloudy appearance. And we found Oodinium parasites. Fish is skinny, it's wasting away. And a pepper cloudy skin. Look on this betta, the peppered appearance, pepper powder appearance. Also on this one, it's difficult to see. You can see it in certain parts of the body. If you look closely, you can see the peppered appearance on that fish. Depends on the light, depends on the color of the fish. And on some fish, like an example I show you here, is the kissing gourami with that transparent tail and fins. You can see the pepper points, the tiny spots. You can see the velvet of the parasite Oodinium, Piscinoodinium. There's a little spots. The microscope, of course, again, is showing me the reality. Can give me the correct diagnosis. On the left here on the tail, you can see all the tiny spots, Oodinium, and in the gills. Oodinium causing a lot of damage, causing secondary bacterial infections and gill rot, and that's why will the fish die. The life cycle determines why you have to check on treatments recommended by the supplier where you bought the product from, because the parasite sits on the fish, drops off and multiplies, and then the babies reinfect the fish in the aquarium. And that stage here, stage F, is the one you kill with your medications in the water. That's why you have to apply certain recommendations to follow for treating more than one treatment, more than one day, to kill all the baby parasites. So the treatment, again, do a good water change. Yes, eliminate the bacteria. Add 5 grams of sea salt per liter. Add copper sulfate solution. Copper sulfate is the best treatment against Oodinium. Not malachite green, not acryflavin. Copper sulfate is the best. There's many products available in the aquarium shop, or you can see in the book, in my books. Do a long-term treatment, at least 7 days, and needs to be repeated to kill all baby parasites who needs time to reproduce, so to come available. Sometimes there is a secondary bacterial infection involved due to the weakening of the fish and damage caused by the parasites. And the bacterial infection needs to be treated without a delay. Do not postpone, because the damage of the bacterial infection, specifically in the gills, that is killing the fish. Raise the temperature 28 degrees. Yes, that speeds up the cycle of the parasite and can be, well, your medication might be faster effective, but there is a risk of stimulating the growth of a bacterial infection. So be aware. When you see bacterial damage, not to do it. Just add the salt and the copper sulfate. But when you see a beginning stage and no bacterial infection yet, yeah, you can raise the temperature. You will have more success with your treatments because the cycle of the parasite goes quicker. You can help with a functional fish food, like Dr. Baslier Biofish Food Garlic. That helps your fish. The white spot disease, a very popular disease in many ornamental fish. Easy to recognize normally with the naked eyes. You see the nice white spots on this betta fish, white spot disease. Here's another betta with white spots, particularly on the dark parts of the body. Easily to see, much difficult to see on this bright blue part of the fin. Here we see it again. The fish here has white spots, has many, but the fish, you can see it's still active, still in good shape. So you still detected it on time, and that's when your treatment will be more effective, because your fish is healthy, fish can accept medication, because the medication is also stress on the fish. And then the fish will usually be treated much easier. Sometimes white spots looks very fine and very dusty-like. Yes, you might be confused with Oodinium. Well, a scraping, taking off a few parasites, will help you to determine what you are dealing with. These betta fish were sick and suffering and clamping the fins, like this one. But because they're so white colored, we can hardly see any white spots. Even on the red ones, we could hardly see it. I'll show you again. Does any one of you see white spots? I could not see it. Well, my eyes are 71 years old. I might miss it. But look, this fish we pulled out and we take a scraping, skin and gills, and we found these parasites. And those parasites are not white, they are brown. They're moving. They're damaging the tissue. They're damaging the skin. Look, that's the parasite's white spot disease. And they look white because they're underneath the mucus of the fish. That's why the appearance is whitish. And in the gills, they can cause serious damage and a risk of invading secondary bacterial infection, causing gill rot and causing the fish to die. So that's what you find with a microscope, and that is not a little tiny Oodinium parasite that is not moving. This is a moving ciliated parasite that is, well, eating on the fish. Typical for ick, white spot disease, that it's sitting underneath the mucus, which you can easily see here in the gill, protected for treatments. No treatment, or the treatment has to go through the mucus, but our medications are not meant for that for fresh water. And sometimes you can see some intrusion here for the white spot came through this mucus layer, can cause damage and can cause secondary bacterial infections. I show this because you have to take care of the treatment of the white spots, taking care of the idea or the knowledge of the cycle. Again, like Oodinium, you have to respect the cycle that it takes a few days when the white spot drops off the fish. He multiplies and creates babies, usually overnight when it's dark. The white spots drop off when it's dark, the aquarium at night, and reproduces within short time, sometimes days. Usually it takes a few days before they grow, become bigger, the white spots, and then multiply at night. So the next morning the fish are infected with white spots. And that's also the stage you have to kill with the medication. That's the baby parasites who are coming alive at night from the big stage of white spots, which are usually laying on the bottom of the aquarium. And that's why you have to put the medication a few days to kill also the white spots which are redistributed in the aquarium. So the treatment, many good medications you can get in your shop. Ask your aquarium shop. But note that you follow the directions of the leaflet, of the flyer, of that medication at least 7 days, because the life cycle of the parasite, well, tells you that you only can kill the babies with the medications. So respect that. Sometimes secondary bacterial infections occur due to the damage caused by the parasites. You might need to treat. A functional fish food can help. Dr. Basler biofish food garlic. And outside Europe, you can still get biofish food matrine, which is developed for helping to control white spot disease. But the EU decided it is not allowed. I have different videos on that, but matrine is the best to be used when a fish has white spot disease. So if you're in Asia or Africa or in America, please try to get Dr. Basler biofish food matrine. And in Europe, try to use Dr. Basler biofish food garlic. Check what could have been the cause. Usually a sudden drop in temperature causes the big fish to become vulnerable for white spot infection. Drops in temperature due to air conditioning, open windows, water changes with too cold water. Because white spots are always around, not always an infection. Just when the fish is weakened, then it can become an infection. See on YouTube my special videos on ick. I will give the links below in the description where you can see them. Details on white spot disease. Well, I also developed an anti-ick method from me, Dr. Basler. where I recommend to use the matrine biofish food. You can also use garlic, because you have to help the fish to prevent that it gets infected, to make sure he gets immune, he restores his strength to fight off the parasites. And you can use a medication like Fanamor in our aquaria, or Protomor when you have invertebrates, to kill the baby parasites, this part. But at the same time, you can help with temperature increase, a fine filter mass smaller than 3 micron. Use a UV lamp that destroys white spot parasites. Siphoning the bottom twice a day, particularly in the morning. Do that, you eliminate parasites. Leave the light 24 on, so the parasite does not reproduce. And meanwhile, you can siphon off the parasites, waiting at the bottom for days to become mature and make the babies. And at night, the babies will come out. But if you have siphoned the bottom, you eliminated them. And you leave the light on, they keep on waiting till it gets dark. And at the same time, use medication. So, recommendations. This is available on our website if you want to see. So, general fish health recommendations is for you to understand that the fish has an immune system, and that you can work on to keep the fish in good condition. You can help with good food, you can help with good water, you can help to avoid stress, because that has an impact on the health of the fish and on the immune system. Because when that fails, and there is bad water, bad food, bad immune system, the pathogens have a chance to create a disease. That's in general my recommendations. Use a microscope for examination. I did that for many different people, breeders, facilities, and they've always been happy with the results. They know what to do, what actions to take, or what medications to use. See my books, my videos, particularly my book, The New Illustrated Guide to Fish Diseases. The link is below. Should be part of your library to help you to care about your fish. Subscribe to my YouTube channel, see more betta fish, more videos on disease of betta fish. I have specifically a playlist on labyrinth and betta fish. This is the link. I will give it you also below. So you might be happy. Interesting website about the general care of breeding fish is at aquahoy.com, betta fish care. Interesting to learn some lessons and practice on taking care of betta. Thank you for watching, because I hope this helped you to understand the most common diseases of betta, or what I have found in my practice as a fish doctor, and what you can do about it. But you listen to this video till the end. That means you learn the lesson. You become more specialized. Thank you for watching, and subscribe. Many more interesting videos for you will be coming, or you can find on my YouTube channel. Thank you for